wasn't, it sounds like we've had a lull in people dialing in. So good afternoon, and thank you so much for calling in, and welcome to CDC's Hemoglobinopathy webinar series. My name is Mary Houlihan from the Division of Blood Disorders, and I'm going to be serving as today's moderator. So before we start the presentation, I want to go over just a few points. First, and one of the most important, is please place your phones on mute during today's presentation. That way we won't hear all of the conversations that are going on and all of the background noise. But at the same time, please do not place your phone on hold. If you do that, the whole audience is going to get your music that plays when you're on hold. So, and also, we're going to wait until after the presentation to open the floor for questions. Since we can't actually see everybody who's on the phone call, I'm going to ask you to electronically raise your hand when you wish to make a comment. And so to be able to do this, if you watch on the screen, you want to click on the Q&A tab on your menu bar at the top of the screen. And then once you're in the Q&A window, click on the hand icon in the upper right corner. And then once you do that, your name will be displayed to those of us organizing the meeting. And so once the presentation is over, we'll call on the participants as their names are displayed. Once we call your name, I'm going to ask you to state your name and affiliation before you ask a question or provide a comment. And so you'll be able to raise your hand electronically during the presentation, but we're going to wait until the discussion period to address your comments. I also wanted to let you know that this session is being recorded, and so it'll be available after today if anybody would like to look at the presentation later. So with that being said, I would like to introduce today's presenter, Dr. Simon Dyson. Dr. Dyson is Professor of Applied Sociology and Director of the Unit for the Social Study of Thalassemia and Sickle Cell at the Montfort University in the United Kingdom. So he's calling in to us today from overseas. He is the author of several books, including Ethnicity and Screening for Sickle Cell and Thalassemia and Sickle Cell and Deaths in Custody. He is currently working with colleagues here in the United States and elsewhere to try to establish a network of social scientists working on sickle cell and thalassemia called WISH, and that stands for the Worldwide Initiative for the Social Study of Hemoglobinopathies. So without further ado, I'm going to pass the microphone over to Dr. Dyson.
Thank you very much indeed, Mary, and thank you to CDC for inviting me to give the first of this public health webinar series on hemoglobinopathies. As I hope you can see from the title slide, my talk is on sickle cell and education, and specifically on the experiences of young people with sickle cell disease living in England in the UK. And on to the second slide, just to thank my funders, the UK's Economic and Social Research Council, slide 3, and to thank also my research team, the other grant holders, and the other research collaborators and research assistants. Slide 4 allows me to acknowledge the various organizations that facilitated access to the young people with sickle cell disease, and to tell you about how they were recruited. Out of a total of 569 young people, around about 400 were recruited through the sickle cell outpatient clinics of King's College Hospital, London, North West London Hospitals, and Guy's and St Thomas's Hospital in London. About another 100 were recruited through the various voluntary organisations for sickle cell that exist in the UK, including the Sickle Cell Society and various branches of OSCAR, Organisation for Sickle Cell Anemia Research. And finally, the remainder were recruited through specialist sickle cell nurse counsellors who worked for what are called our primary care trusts in Hackney and Newham in East London, and in our second city, Birmingham. On to slide 5. Now, the data that I'm going to talk about concerns 569 young people with sickle cell disease aged 4 to 25, and we received questionnaire replies from them about their educational experiences, and we're also drawing on 40 depth tape-recorded interviews with a selection of those young people. On to slide 6, reported type of sickle cell disease. Now, it's important to say from the outset that any of our clinical data I'm going to refer to is not strictly speaking clinical data. It's reported clinical data as stated to us on the questionnaire returned by the young person. It's not data that we derived from medical records, so we need to make that caveat. But just to situate the data, just over 70% of the young people said that they had sickle cell anemia, SS. Just over 14% said that they had hemoglobin SC disease, and if those numbers seem a little low, it's because nearly 10% said that they didn't know their type of sickle cell disease. Line 7, more about the sample of the 569 young people with sickle cell disease. Roughly equal number of females and males, and age-wise, the majority fell into the main schooling ages of between 5 and 18. Slide 8, self-reported ethnicity. You can see that many different ethnic groups are represented in our sample, including a small number of white English respondents, white Mediterranean, a small number of Asian, what we would in the UK that we use Asian to refer to people of Indian subcontinent descent, but the overwhelming majority are either black British of Caribbean descent or black African descent, and that's quite important because clearly if you have a changing population, and I'm not familiar with the United States to know whether you have any significant recent migration from of people of recent African descent, but compared to either our black British Caribbean population or your African American population, the carrier rate and the prevalence of sickle cell disease is likely to be much higher, and that has significant public health implications for how you prepare services, both health services and in this case education services. And the fact that it's the black African groups in the UK that are where we're drawing our highest numbers from is a reflection of this data from our newborn screening program in England, which suggests that although one in just over 500 of our newborn white British babies are carriers of a gene clinically relevant for sickle cell disease, that figure is 1 in 7 for our UK-based black African groups. Now on to some of the findings relating specifically to education. In our questionnaire, we asked our respondents how many school days they had missed on average each year related to their sickle cell, so not absences for other types of illness. And those of you who can see the slides will see that this ranged from no days at all to 200 days. Well, 200 days would represent pretty much the whole of a school year. The average, by which we mean the mean, was just over 16 days, 16.27 days. The most frequent reported number was 10 days. Now, in the UK, certainly in England, we have a particular Act of Parliament, the 1996 Education Act, and associated policy guidance that places a duty on our schools to make alternate provision for any young person who misses school for more than 15 days. And as you can see, the average number of days being missed by our sample of young people with sickle cell disease exceeds that 15 days at over, in fact, 16 days. And we'll come back to that threshold in just a minute. Another important threshold that's written into our policy in education in the UK is that the government's concerned with truancy, and it defines any pupil who misses more than what they call 63 sessions, and by a session they mean half a day. So very roughly, if they miss more than 32 days of schooling, they're defined by our Department of Education as persistently absent, and that's an important threshold, because we find that over 12% of our sample of 569 had missed more than 32 days of schooling. And this concerns us because it's also apparent from speaking to some of the mothers that mothers and the children are being blamed and are being caught up in surveillance nets designed to police levels of truancy, when in fact the young people are missing days from school associated with their sickle cell illness. On to slide 11, school days missed per absence. We also asked the young people when they missed days off school, how many days in a row did they miss? Now the range here was from 0 to 112 days. The mean was just over 7 days, but the more important figure statistically here is arguably the mode, the most frequently reported pattern of days missed. And the number of days most frequently reported were 2, 3, or 5 days. So it seems that the typical pattern for young people to miss schooling is to miss it in short blocks of 2, 3, or 5 days. But this then suggested to us why it may be that the young people with sickle cell disease were not getting support, and this is because although they may be missing more than the statutory level of 15 days, they appear to be missing it in short blocks of time that cumulatively over a year may add up to more than 15 days, but which are not 15 days in a row, and therefore, if, as seems to be the case, our schools are interpreting the guidance in a very narrow sense to mean 15 days in a row, then that's never actually triggering any obligation on the schools or our local authorities to do anything to put support systems in place and to make, as is required of them, the alternative provision for young people with a chronic illness like sickle cell. On to slide 12, clinical symptoms and school absences. That should really be reported clinical symptoms, because if you'll recall, these are what is reported to us through questionnaires. And this really helps us to kind of just to situate our findings, really. Because clearly if it was simply the case that the level of severity of disease were what was influencing school experience, then that would be one story. But broadly speaking, that's not what we think is happening. If you look at the apparent difference between those with SS and those with SC, there is a difference, but it's not statistically significant. Between those who report having had a stroke and those who don't, the difference again is not significant, but it's actually in an unexpected direction. Those with no reported stroke seem to have more days off than those who do report having had a stroke. We then also asked our respondents about types of service contact, and this was our attempt to characterise our sample in terms of their disease severity as roughly indicated by 4 types of service contact. Were they undergoing regular blood transfusions? Had they ever had an emergency blood transfusion? Had they been admitted to hospital more than 3 times in a year? And were they taking the drug hydroxyurea? And again, in terms of blood transfusions, the results were either in an unexpected direction, with the apparently more severe cases actually having better school attendance, or the differences were not significant. When it comes to being admitted to hospital more than 3 times a year, it's certainly the case that that difference is very highly significant, but then in a sense that particular association is circular. You would expect those who are laid up in hospital not to be attending school. The other significant finding was that those reporting taking hydroxyurea were more likely to be having higher numbers of days off school. And again, it's a bit difficult to interpret that, because if hydroxyurea was working, wouldn't you expect that difference to have been minimised by the effects of the drug? But anyway, not a clear no kind of clear messages really coming out of that data. When we looked at the association between the reported number of days of school and the 4 types of service contact taken together as an indicator of severity, we found that only about 14% of that association could be explained by severity as indicated by service contact. And when we looked at reported number of days off school in relation to reported number of crises, only 4% of that association could be explained by that particular link. On to slide 13. So overall, in terms of school absences, I think the broad message that we want to say is that the best you can say is that school absences in our sample are not easily explained by their reported clinical symptoms. And in that sense, we feel we need to look to social factors behind the school experience and not simply think that we could read those off from clinical severity of sickle cell disease. We asked a question, sorry, this is slide 14, entitled How Much Caught Up? And this was a question where we tried to get the young person's perception, and again, as a questionnaire-based study, this is just the young person's perception of what is happening to them. And we asked them, when they missed days off school, how much did they perceive that they were helped by the school to catch up their lessons that they'd missed? And we gave them a scale in which 0% represented I've not been helped to catch up at all, 50% represented I've been helped to catch up about half of what I've missed, and 100% represented I've been helped to catch up everything that I missed. And as you can see from the results, only a small percentage, 6%, felt that they'd been helped to catch up everything that they'd missed as a result of their school absences. Conversely, nearly 1 in 5, 19%, felt that they'd not been helped to catch up anything at all of the significant amount of schooling that they had missed. And if we take the first 3 bars on the bar chart, we can say that over 80% of our sample of 569 young people felt that they'd been helped to catch up 50% or less of what they'd missed of their schooling associated with sickle cell related illness. Slide 15, reported experiences in schools. We also asked the young people about 4 key experiences, and I'll say at the end of the slide why we asked these particular questions, but just to tell you the results first of all. Clearly, young people with sickle cell disease can't concentrate urine as readily, need to go to the toilet more often. However, 57% of our sample said that at some point they'd been prevented by the teacher from going to the toilet when they needed to. One of the kind of preventive measures that you will know very well is key to maintaining good health is to be well hydrated, to maintain a good fluid intake, and yet nearly half, 46% of the young people with sickle cell disease said to us that they'd been disallowed from taking a drink of water during class. It's clearly the case that young people with sickle cell disease need to be encouraged to take moderate exercise, but also to be cautioned to avoid strenuous exercise, the kind of exercise that where you're pushed to your limits to exhaustion, such as, for example, a cross-country run in the cold and the rain. But over a third, 36% of our samples said that at some point they felt they'd been made to take unsuitable exercise by the physical education teacher or by the school in some way. And also those with sickle cell anemia will obviously be suffer from fatigue, they'll be anemic, they'll feel tired, they may not be able to concentrate, they may feel lethargic in class. And again, over a third of our young people said that at some point they'd been called lazy by their teacher when they were tired. And the reason that we asked those 4 questions was that 2 of the members of the research team have each spent the last 25 years working in the sickle cell area in the UK, and we've experience of sitting in voluntary groups and support group meetings over that period of time, and hearing mothers especially say that these things are happening to their children in school, and yet nothing has changed over the years. And we wanted to just try and establish how widespread these practices were, so that we could give a conclusion about whether this was the odd case, or whether this was something that was happening more systematically. Now to, slide 16, headed water, to flesh out some of the details on this by reference to some transcripts, some excerpts from the transcripts of our one-hour tape-recorded interviews with the young people. And it's through some of this more qualitative data that we became aware of what it is about the school environment that seems to be getting in the way of permitting good care and self-management on the part of the young person with sickle cell disease. Now, this is a young woman, age 13, of black African descent, and she's saying about being stopped from drinking water. She says, "I had to get water when I was in class. I told my teacher, but she said I should have got water from the nurse at lunchtime. And also, there's a warning score. It says you can't get a drink during class time." Now, those of you who can see the slide will see we've got warning score in brackets. That's because we can't, on the audio tape, we can't quite make out what the young woman says, but we feel she's talking about a notice or something of that kind that's been put up in the classroom saying that you mustn't get a drink. And this is beginning to indicate to us that there's something about these school routines, there's something about the way in which schools have to organise themselves to maintain an ongoing flow of everyday education that gets in the way of them permitting good care, self-care and management on the part of the young person. And we can see this more distressingly in this case about in slide 17, headed toilet. And this is the mother of a young boy, age 6, talking about, yet again, turning up at school and finding that he's wet himself, he's wet his pants, his trousers, and it's not the first time it's happened. She says, "There is also a second time when he went to school. My daughter went to pick him up. He was all wet in his pants. I was upset and said, no, the teacher should know that this child has sickle cell. Sometimes he needs help. He is a sick child, and of course he needs help. But he wet his pants, and he stayed wet until my daughter picked him up." And the mother was practically in tears in saying this. Now, why would a school not permit a young boy to go to the toilet? Well, if we look up slide 18, we begin to get a clue about why this might be the case. This is a young man aged 16, and he's thinking back to his early years education when he was younger compared to now. And he's talking about not being allowed to go to the toilet when he was in his early years education. And he says, "Unless I would explain to them, the teachers, just ask and nag them, and then maybe they'd let me go to the toilet." Because they kept on saying, they said it was like a way of preparing you for secondary school, because they thought we wasn't allowed to go to toilet during class. So here's a situation in which the early years teachers have in their mind the idea that when the young boy goes to a bigger school where he's moving around between classrooms and perhaps in a school of thousands, a very complex organisation, that he's not going to be allowed to go to the toilet. So they better get him ready now and start to implement the type of routines that they anticipate he's going to have to conform to when he moves to his later years education. And I should say that we also have other examples, which I'm not going to, I don't have slides for in this presentation, but which suggest that other reasons why schools don't allow drinks and toilet breaks are to do with trying to prevent truancy and trying to make sure that when you're in what one transcript talks about being in a lesson that's going to lead to an examination where the school is going to be judged in a kind of competitive league table about how well they've they've got their pupils through those examinations. And the young boy was saying, well, basically you're allowed to have the water and go to the toilet if it's a lesson that doesn't matter, but if it's a lesson that's going to lead to an examination where the school's going to be judged, then you're not allowed to go. So again, it's beginning to suggest to us that it's something about the school routines that's getting in the way of good management. This one concerns a young woman who's not listened to by her teachers. And the context for this quotation, which runs over 2 slides, is that the young woman is taking part with a number of different schools, again early years schooling, and they're going to a local church hall community centre along with several other schools, and they're all dressed in various fancy dress costumes, and therefore not particularly warmly dressed, in order to present various school plays to each other. And the young woman says, we weren't allowed our coats on, and I remember that I started to cry because I really wanted my coat. I'm not going to freeze. Everyone else was cold. I wasn't making a big issue out of it because I remember everyone else around me was cold. Even the people who came with us were like, yeah, it is a bit cold, and these are young kids. And there was like, no, one more time around. In other words, the teachers were saying, no, you can't go off and get your coat. You've got to parade once more around the stage. And she says, I stopped. I refused. I could just not be bothered. I just could not. I went mad. My fingers were just numb. Everything was numb, and I started to cry, and I felt a sharp pain. And then it all went downhill from then. Because my face was covered in gold paint, and I started to cry and everything. And I started to cry, and everything just kept running, and I got sent home after that. Onto slide 20. And the interviewer says, I was going to say, how did the teachers react? And she goes on, they were just like, oh, it's not that cold. I remember one teacher, she didn't like me very much. She was like, it's not that cold. Oh, suck it up. And I was like, I am not sucking it up. It's cold. I want my coat. And she goes on, I got really numb. I got really still. And then I just started to cry. I was in one spot crying real hard, and I just felt this pain and a half. And she then goes on to recount how she ended up with a sickle cell crisis that required hospitalisation. Slide 21, headed exercise. Again, this is a young young man, aged 15, Black Caribbean descent, and he's basically sitting out a soccer game, what we in the UK call football. And he says, my teacher, I was in PE class, and like he was keep on like pushing me, and I didn't like much football, and I'd tell him I didn't like doing, and like when I was sitting out, he'd come up to me and say, stand up and like play the game. Now, and again, this young boy recounts occasions of going into crisis as a consequence of being pushed when he wanted to sit out sports activities. But there's an interesting phrase at the end of that quotation, play the game. Play the game is a famous quotation from a 19th century Victorian poem written by an upper-class Englishman who was writing a poem about his own experiences of going to what we call a public, but it's actually a fee-paying school for the rich, privileged, elite upper classes of 19th century England. And the poem basically makes the case that if you can learn to exhibit stoicism and tenacity in the face of overwhelming odds when you're playing sport, then you can translate those moral lessons into fighting in wars, particularly colonial wars in Africa. So, of course, this is a young man whose ancestors were kidnapped from Africa, transported across the Caribbean to the Caribbean in the slave trade, and whose more recent ancestors then came to the UK post the Second World War to do the dirty, environmentally unfriendly and unpleasant, hard manual labouring jobs that the white British didn't want to do. So it's a real symbolic insult to be not only faced with being forced to do exercise, but to have that rhetoric of that draws on that particular history. This young woman is sorry, I'm slide 22, headed lazy. This young woman, age 16, of black African descent, is feeling tired and she's lethargic, and she's got her head rested on her hands on the school desk. But the teacher pounces on her. The teacher says, calls out her name, shouts at her name, "Why is your arm on the table? Why are you so lazy?" And she says, "You know, it's like I'm not lazy, I'm just tired." And she says, "It just got to the point where I was so tired I couldn't be bothered to argue, so I just walked out of the class. And then the teacher came, 'Why did you leave my class?'" So not only is she disbelieved and her tiredness constructed as laziness, but when she tries a tactic of kind of distancing herself from the situation, she finds herself in more trouble because she's broken one of the cardinal school rules, being present and you know, only leaving the class with the teacher's permission. This quotation, slide 23, headed "Pain," is about the difficulty of learning in pain, but it's also about, it's quite a complex one to explain. I'll need to refer to some notes, I think. Let me read it first of all. She says, yeah, it's really hard to take it in. Even now I'm struggling with it. Like when you try to listen, you don't feel alert and your body is aching, and it is just that you don't really learn. You can't take it in. It's really hard. So she's talking about when you're in pain in school, it's hard to take in your lessons. It's hard to understand your lessons. She says, I mean, it's hard in school where school is because of my attendance. They also put me in certain subjects, and what is it? I have like 1, 2, 1, 3, like groups of, say when you do exams, you can just get from C to E. You can't get a higher than a C. Well, there's a lot of things in the broader context of a transcript that she's kind of referring to here. She talks about being a good student and getting grade A's and B's when she does coursework, but she's off school a lot with her illness, and when she comes back, she's missed the learning that would allow her to do well in exams, and she only gets low grades in exams. The teachers then feel that she's not very bright, and they put her with other pupils who are not achieving well, and even put her with what we call special educational needs children. She's also denied the options offered to other students. Other students at certain ages get the choice between what subjects they would like to continue with. She doesn't get that choice. She simply comes back and finds she's been placed in subjects that not of her choosing. And finally, we have unfortunately in the UK, certain types of exams which are basically second-rate exams. They're exams which are allegedly easier, but where even if you do very well, your upper grade is capped. So when she's saying you can only get from C to E, you can't get higher than C, she's saying she's been put into these second-rate exams where however well she does, she's not going to get grades A and B. Now, this is all of those things that I've just said kind of indicate that, and remember that most but not all of the young people we're talking about here are of either black Caribbean or black African descent. So broadly speaking, we're talking about the experiences of black pupils in education, and we can't really look at that without looking more broadly at what's happening in schools. This is where the illness itself interacts with other social factors that are going on. And if we look at slide 24, headed Black Performance Relative to Local Education Authority Average, and I'm drawing here on the broader evidence from the sociology of education in the United Kingdom, particularly the work of David Gilbourne, a professor at the Institute of Education in London. Now, he makes the argument that successive governments have constructed the issue as one of educational failure of black pupils, and that in constructing the problem in that particular way, what they've suggested is that that's something that's naturally occurring and is out there, and that schools and local authorities and the Department of Education need to put in place certain extra special kind of social engineering type arrangements that will turn that problem around. And he argues that they actually constructed the problem in an entirely fallacious way. And he cites some unpublished evidence that from official statistics that suggests that when you compare the performance of black pupils and white pupils and control it for socioeconomic status. So all the figures in the bar chart on the slide are controlled for socioeconomic status. He finds that at age 5, at the beginning of compulsory schooling, the black pupils are 20 percentage points ahead of their white socioeconomic equivalent counterparts. However, something happens in schooling that means that by age 11 they are 2 points behind, and by compulsory school leaving age 16, they're 21 points behind. In other words, a completely different story, one in which black parents have successfully prepared their youngsters very well to start school, and that all that good work is successively undermined the longer they stay in the British education system. So I think when we look at what's happening to young people with sickle cell disease in schools in the UK, we need to put it in that broader sociology of education perspective to understand how chronic illness may be interacting with other social factors that affect life chances. Slide 25, headed leg ulcers, just a final example of how school routines and self-care don't always kind of match up. I don't have a quotation for this one, but this was a young woman who had severe leg ulcers but was wearing long trousers, long pants as part of the school uniform, so they were hidden. She was in pain and limping slowly around at what was quite a large school campus, and was constantly getting in trouble being late for lessons because of the pain and the distance that she was walking. On to slide 26, headed parents. Now, if only the parents going into the school and pointing some of this out to the schools was, made the difference. But a number of the mothers in the course of our collecting data made the point to us that they were quite often constructed by the school as aggressive parents, being pushy for trying to advocate on behalf of their young child with sickle cell disease. And in one case, a mother contacted me to say that the school had questioned her psychological kind of psychiatric status, saying, are you kind of in some way mentally disturbed because of the stress of being a single parent, because you keep on going on to us about needing to care for your child with sickle cell disease in school. And it was only when we took an off-print of one of the academic articles that we'd written describing the numbers of school children with sickle cell disease who were facing these problems, and she took it into the school, that they actually believed her. And this was something that we found that quite often mothers weren't believed, and it was only when you had the warrant of a letter from a consultant or a specialist sickle cell nurse going into school, or in this case me giving her a research report, that the school actually began to take the mothers seriously. Now, if only, I said, kind of telling the schools and the teachers were the only key to making a difference, and it's certainly kind of standard advice. I have on slide 27 a quotation, one from the US, one from the UK, from various health education advice. It's important to talk to your child's teachers and school nurse about sickle cell related problems your child may have in school or in schools. Health promotion amongst both pupils and staff is important so that affected children are not bullied and stigmatized. Now, does that make the difference? Well, we had, slide 28, we had a broad indicator of the range of significant adults who reportedly knew that the young person had sickle cell disease. So we asked them, did the head teacher know? Did the head of school year know? Did most of the class teachers know? Did the PE teacher know? Did the school nurse know? So for each young person, we had a count of between 0 and 5, which indicated the range of types of adults who reportedly knew that they had sickle cell disease. Slide 29. We also had a count of between 0 and 4 for any one young person about how many of those 4 types of negative experience, being prevented from drinking water, prevented from going to the toilet, called lazy when tired, or made to do unsuitable exercise. For any one young person, we had a count of between 0 and 4 that they'd experienced between 0 and 4 of those negative experiences. And if we look at slide 30, we've produced a cross-classification of how many types of adults know that you have sickle cell against how many types of those negative experiences have you undergone. And for those of you who can see the slide, in the bottom right-hand corner, I've left the numbers blank and put a circle with a question mark, because that's the area of the table where, in an ideal world, there ought to be a series of zeros, where 2 or more types of adults know, but the young person has had 2, 3, or 4 of those negative experiences. And if we look at slide 31, the numbers have now been filled in red for those of you who can see it, and there are quite large, significant numbers still in those boxes. In other words, there are large numbers of young people with sickle cell disease where most of the school adults know, but they're still being prevented from drinking water, going to the toilet, being called lazy when tired, or being made to take unsuitable exercise. And if you actually count up the numbers, those cells are 40% of the table, and the numbers add up to 40% of the numbers, just about. So what ought to be, in an ideal world, a series of zeros or very low numbers actually turns out to be exactly the numbers that you get just in the usual operation of chance. And so we feel that we can't really say that there's any strong relationship between letting it be more widely known that you have sickle cell disease and that resulting in improved school experience. So our broad conclusion is that what we feel needs to happen is there needs to be a change in the social environment of schools in the way that they support young people with sickle cell disease. When we followed up that kind of cross-tabulation that we've just looked at in our depth interviews, it became apparent that young people themselves have very mixed responses to others knowing that they have sickle cell disease. The majority were in favour of adults knowing, but a significant minority were very against even the significant adults in the school knowing that they had sickle cell disease. And there was a lot more ambivalence about other school pupils knowing. There was roughly 4 categories there. About 25% were in favour, 25% against, 25% kind of told us pros and cons at different points of the interview, and another 25% kind of vacillated throughout the interview and were ambivalent about whether others should know. So that leads us to conclude that what we need to do is find a way to support young people with sickle cell disease, irrespective of whether they themselves wish to be open about their sickle cell disease. And to give you just one of a number of examples that we've come across, one school, in terms of helping pupils catch up when they missed school for any reason, they'd operated a system not of just sending worksheets home, which pupils tell us that they can't always interpret. They had in the early evening, immediately after school, they had a catch-up session for any child who'd missed school for any reason, with a teacher present who could interpret any worksheets, who could give them advice. And this was highly valued by the young person with sickle cell disease. And interestingly, when we probed the school, they didn't know that that young person had sickle cell disease. So he was being helped in the background without having to draw attention to his sickle cell disease. Now, we also think that there's some kind of public health lessons about our study. Quite often, particularly in the UK, when we talk about care that's not in hospital, we talk about care in the community. But perhaps as much as 50% of a young person's waking hours may be at school. And so school and preventive health measures in school seem to us to be extremely important, but perhaps very much overlooked. Now, we also did some very preliminary health economic costings. We looked at, what if these young people are becoming ill and going into sickle cell crisis and incurring hospitalization expenses when they need not become ill in school. And just by making some fairly conservative estimates, and then also factoring in, of course, that sickle cell disease is a cumulative chronic illness, so that if you have a number of acute episodes, you're likely to develop more long-term disabling complications of sickle cell disease, which then, in terms of translating into economics, may mean that either you don't go into paid work and contribute taxes, and even possibly that you may be dependent on welfare benefits. We very rapidly got to several, millions of dollars that could be saved. So we do think that there's a good public health project to look at, what would be an appropriate intervention to improve the school environment that would reduce hospitalisation and long-term costs of supporting people with disabilities. And the final slide 33. Just to say that if you want to explore more about our research program, we have a website, www.sicklecelleducation.com. It's got a downloadable 4-page research summary that can be printed out. It's got links to the 6 academic articles in journals like Sociology of Health and Illness and Social Science and Medicine that have been published. And it's also got a model school policy leaflet. And just very briefly, this has been produced under something called Creative Commons. This is something that I'm new and learning about myself. But basically that means that that school policy leaflet can be taken up and adapted by other people for your own purposes. In other words, that you could, change anything that you disagreed with. You could add a contact address for a local sickle cell chapter or support group. You could change some of the context that's currently written in its UK format to reflect the US or other countries' context, as long as you comply to 2 conditions. One is BY, which means basically the leaflet was written by someone, namely our research team, and we just ask that you credit the people who originally produced it. And secondly, that it's SA, which stands for Share Alike, which means that if you do take it up, modify it, and produce something for yourself, we simply ask that you share it back with the sickle cell community worldwide. So I'd like to end there and thank you for your attention.
Thank you so much, Simon. We really appreciate you taking part today. Your presentation was fantastic. So now we're going to open the lines up for questions. I want to remind everybody to keep your phones on mute if you're not currently speaking. And if you do have a question, you need to electronically raise your hand, and then your names are going to be called in the order that those questions were received. So just as a reminder, we only have 1 hour scheduled for this line. We're going to need to stop this session once we reach that time point. Please don't get your feelings hurt. If you have further questions for Dr. Dyson, I'm sure he'd be more than happy to answer your questions. If you want to contact him.
No, this is for the, not just the office.
Okay. If you want to contact him at the email address given on the slide. So I'm going to go ahead, and the first person, Sandy Aponte. Did you have a question, Sandy? Okay, I'm going to go then to the next question, which is from Carlton. Did you look at school attendance of siblings as potential additional explanatory variable?
No, the brief answer is that we didn't, I'm afraid, no.
Yeah, it's related to a study that I had done locally with my program in Philadelphia, and we had seen some of the really largest outliers in school attendance when we looked at sibling reports. Many of the siblings who did not have sickle cell disease were also very poor attenders, so that in those situations there clearly was some family factors that were variables that were unrelated to the disease severity.
Although, of course, it could also be the case that if the mother had to have time off work to look after the child who was ill, she may then have had difficulty kind of combining that with getting other children to school.
Absolutely. So a variety of family factors were important. And the other sort of related question was, at least in the U.S., in many of the school systems, we have enormous challenges with the school system providing medication, particularly analgesic medication, during school. And I was wondering if that was a theme that had come out in any of your discussions with the children or the families.
It certainly was. On a slide that I haven't shown, only 27% said that they had ever been allowed analgesic medication in school, and this the kind of legal situation in the United Kingdom is that my understanding is that any individual teacher is not obliged to offer that medication, and we've been pushing the argument that we can't see, we couldn't, for example, envisage a situation in which a school refused a child with asthma their inhaler. So why is there a different attitude towards children with sickle cell disease and analgesia? And so it sounds like we have very similar challenges in the UK as you do in Philadelphia.
Yes. Thank you.
Thank you.
Okay, great. Thank you. And I'm sorry if I mispronounce your name, but it looks like Adeyinka Falusi has some comments as well. Adeyinka, are you there?
Yes.
Yeah.
Comment? Yes.
Go ahead.
Yes. I'm a doctor. I'm from Nigeria. I'm at the University College Hospital, Nigeria, and I also do quite a bit of public health work. I'm a geneticist in hematology, and this area of public health is really very important, so I'm happy sharing this. The points you have raised are so important, but the problem is with the third world or with the developing countries, our situations are far more difficult than these ones, because you're talking about school absenteeism is so much more, and going to drink water, there is even no water to drink for some of these children. The clothing is poor at times, and so there is a lot of problems, and we are just hoping that we could work more with guys, especially as you said in your last statement, that we can use your leaflets and use it for further education. I know there's a lot of work to be done with caregivers in Africa. The parents, they are suffering without money. The hospitals are not that good. The drugs are not there. And we need hydroxyurea. It's difficult to get. So there's so many things that we have that are problems. But I thank you for sharing this with us, and I hope I can make good use of your leaflets to be able to continue my program in helping and assisting the patients.
Yes. Thank you, Lucy, for your comments. Thank you.
Thank you very much. I don't see electronically that anyone has any questions, but is there anyone that's just listening in that isn't able to reach us through their computer that has a question for Dr. Dyson? Okay, well, thank you guys very much. It looks like we ended about 2 minutes early, so our next webinar is going to take place on Thursday, March 24th. And the topic of that webinar will be iron overload in children with sickle cell disease. If you have any questions about that webinar or any of the future ones, feel free to contact Shay Pope here at the CDC. Her email address is spope@cdc.gov.
Go to the phone.
And I just want to really say thank you, everyone, for participating and for calling into today's call. It looks like we had a very large number of people listening in and watching the webinar, and I just want to say thank you so much, and especially thank you to Dr. Dyson.
Thank you.
All righty, then we will see everyone or talk to everyone in March. Thank you very much. Bye-bye.
Bye.